Have you been diagnosed with Parkinson's disease? Do you have symptoms like your body is shaking? Is your head and neck shaking? Is there a tremor in your body? If you answered yes, I think you really want to watch this testimonial from this patient who's had incredible success with my method, my rapid health recovery system. My name is Dr. Lonnie Herman, and I've got something incredible to share with you, and so does she and her husband, to share with you of the incredible healing that she's experiencing and has experienced by following a customized protocol I developed for her. If you're suffering from tremors, you deserve to know that there are most likely hidden disease-causing infections and chemicals that you need to find and get rid of so you can have normal function in your body again. In this video, we're going to take a break in just a moment. You're going to hear a very brief couple of minutes of a testimonial from her and her husband. You're going to see the before and after, side by side, watching her head shaking and the pain on her face, to after just a couple of months of following a protocol, how she's really different, very positive, and multiple other symptoms disappeared from her body like they never existed. So we're going to take a break in a moment and watch that brief testimonial. Then we're going to come back. I'm going to make you a free offer that you can take advantage of. And after that free offer, I'm going to describe to you what I found and what we treated in her brain and her body in her first protocol, and then share with you her entire testimonial. I think that you're really going to enjoy that feeling that there is hope and there's a possibility that you too can finally experience relief from your terrible condition where the doctors and the medicines have not provided you any relief or hope for yet. So let's take a break for just a few moments. Let's listen to what she and her husband had to say and some brief highlights of the testimonial, and I'll be right back. One of your symptoms was you had a very poor range of motion in your neck.
Yes.
You couldn't even turn your head really right and left.
No.
And now go ahead, without turning your body, see if you can turn and look at your husband right now. The range of motion
my
is
husband and
tremendous. Tremendous. Your head was constantly shaking.
Yes.
Constantly shaking.
Yes.
So the range of motion has improved tremendous.
Oh, tremendous.
The shaking of your head, it's still there.
It's
First
still
round,
there.
only one protocol that we've
Right.
done, but you've reduced the severity of the shaking.
Yes.
And you've reduced the amount of the frequency of the tremors in your head.
Yes, sir.
Yes, okay.
She had a huge bump there, and then between the shoulder blades, because I gave her massages to help her out, she also had muscle bumps, I guess, or where the muscles are all tensed up. And those have went away 95%. I mean, if I put my arms over when I give a massage, I can feel that there's some tension around there, but they basically have gone, and that is just amazing. Before, when she would lay down on her back, you could literally just, if you looked across it, like a piece of it, I mean, you could literally just see these bumps, and of the muscles all, the tension in them. And like I said, they're like 95% gone. Phenomenal. I mean, I have to look for them now.
Cold feet. That was a constant problem?
Yeah.
Even in the warm weather?
Yes.
Do you have cold feet anymore?
No,
Totally
I do
gone.
not. It's totally gone. It's
Even
totally
in the
gone.
cold weather, you feel
Even in the cold weather. It's great.
Phenomenal.
Yes. Smoked cigarettes for years, and I would go up and down my flights of stairs, which I have to in my house, and I would be heavy breathing. And
just doing one flight.
Just one flight. It was usually up the stairs, but dancing too. I loved to dance, and I couldn't dance very much anymore, and now I dance all the time again. It's wonderful. Fourth day of my protocol, I ended up not having to breathe heavy, going upstairs. I have stairs at work I have to go up, and I don't have to take a deep breath when I get up and go.
It's not just a step of flares.
No.
We have now she can go from the basement to the second floor of the house
Yes, it's
without
wonderful.
having issues.
You had a really bad, overactive, uncontrollable bladder. Urine
Oh,
bladder.
yes. I had to go through several pads a day, and it was very embarrassing to have. And I have no issues. I have not wore pads for a couple months. Yeah, a couple months. It's wonderful.
If you've went through and you've dealt with pain of any sort and you're getting nowhere with the doctors, and you sit there and you're thinking that this stuff just sounds too weird to be true, it's
true.
not. It really isn't. I mean, yes, you're going to have to take a little leap of faith. I would say go for it. I mean, you're not going to regret it.
Thank you.
Never going to regret it.
Thank you. All right, isn't that just incredible? You see the look on her face, you hear their description. It's just awesome how much improvement she's finally experiencing only as a result of the unique work that I've offered her to get these different infections and chemicals that I'm about to share with you now out of her body. All right, let's take a break for another moment. Let me make you that free offer, and I'll come right back and we'll describe her exam findings, okay? You can go on my website and download my book for free, but how you can reclaim your health, how you can use quantum energized medicine protocols to actually reverse seemingly incurable chronic illnesses or chronic diseases. Download my book, read it. It's very simple, 40 pages. Maybe it'll take you about an hour. And inside that book, there are a lot of big pictures. It's big font. There's not too much reading, literally maybe an hour. There are 3 links inside my book that you should click on and read more about my work, about my unique quantum food sensitivity assessment examination that we perform on every patient, about my quantum dental assessment, as well as on the very last page, I highly recommend, because you're going to want to know how I do what I do for people. I give a brief insight to that on my journey as a physician to become your physician who gives you the answers, as well as into my method of how I'm doing what I'm doing and the science behind it. On the very last page, click that link. It brings you to a private page on my website. And on this page, you can watch a 42-minute video in where I'm presenting my journey as a physician, the type of labs I used to run, my education, my background, as well as my method, okay? What I discovered in her first exam in November of 2021, I found that her mitochondria in her brain was very weak, and the mitochondria of multiple parts of her body were very weak, and her body's energy was so low that it couldn't help control the way the brain, the head, the arms, the legs, the bladder, her breathing, it couldn't regulate how it's supposed to function that we expect it to, the way that she felt 30 years ago. I found in her cerebral spinal fluid, which is the fluid that's in your brain and around your brain and spinal cord. Whenever there's infection and or toxins in and or around the brain and spinal cord in that fluid, it can cause inflammation. It does cause malfunction in the body, whether it's a headache, a high blood pressure, a shaking head, a shaking hand or leg, stiffness, rigidity in the body, muscle pain, bladder incontinence, shortness of breath. Any of these symptoms can, and were for her, can be attributed to your condition from a cerebral spinal fluid infection or chemical in there. I found multiple different mold toxins in her cerebral spinal fluid. I found mercury from the teeth affecting her motor neurons, the neurons that are in the cortex of the brain that control the spine, control the neck, control the hands, feet, legs, arms, shoulders, hips, knees. The motor neurons were toxic with mercury from her teeth, silver-colored filling, in other words. I found all those different mold toxins in her motor neurons, affecting them, weakening them, stressing them, diseasing them, causing motor control disorders in her body. I found that the glymphatic system, which is the lymph of the central nervous system, the glia lymph system or glymphatic system, I found a fungus called mucor in and stressing her glymphatic system. I found that the cerebellum that controls all the neck spinal muscles and all the spinal muscles, therefore down the whole spine, the cerebellum, there was a Brucella bacteria infection. Also toxic load from dental anesthesia chemicals in there. Anesthesia chemicals leave the mouth 3 to 4 hours after your cavity filling or tooth was pulled or root canal procedure was done. When those dental chemicals, those numbing agents wear off, where do they go? Do they just disappear? Or do they travel through the blood and the nervous system somewhere else in your brain and affect the way your brain's going to control your body, causing a malfunction like a neck and head tremor, like an arm or hand tremor, like a stiffness in the arm where you can't swing your arm properly when you're walking. I found multiple dental anesthetics stressing her cerebellum. I found the anesthesia chemical called propofol, the anesthesia chemical that put her to sleep at some point for a procedure, in her cerebellum. Multiple inflammatory stressors of activated mast cells and inflammatory protein called MMP9 affecting her cerebellum. I found the dengue fever virus stressing her cerebellum, xylocaine, which is an epidural chemical, in her cerebellum, botulinum toxins affecting her cerebellum, multiple bacteria infections affecting, stressing, diseasing the function of her cerebellum. I also found that her kidneys were loaded with the epidural. The kidneys were loaded with the dental anesthetics and the surgical anesthetics. I found multiple mold toxins affecting her kidneys, the fungus infections affecting her kidneys. I found pesticides and weed killer sprays in her kidneys, the influenza virus, Epstein-Barr virus, and lipopolysaccharides stressing her kidneys. When the kidneys are stressed, back pain is common. When the kidneys are stressed, it changes the blood pressure flow to your brain. Oxygen levels to your brain can be depleted to I shouldn't say depleted, turned down 1-2%, let's say, for example. How is the brain going to function when it's not getting perfect amount of blood pressure? Even if you're not on blood pressure medications, kidney infections and toxins in the kidneys can and will cause back pain, leg pain, foot pain, stiffness in the body, shoulders, hips, knees, ankles, toes, plantar fasciitis, even change in brain function because of toxins in the kidneys, infections in the kidneys. I found her whole lymphatic system, the whole lymphatic system from head to toe, stressed by activated mast cells, causing systemic inflammation in the brain and the body. I found she had viral infections in the spinal vertebrae. I found her lungs affected by toxins from her years of tobacco smoke or cigarette smoking. I found the MRSA bacteria, MRSA bacteria, infecting her lungs, parasitic infections in her stomach, and the brain, her brain, had multiple candida infections as well as toxins A and B from the C. diff bacteria. After that protocol, she came back, that protocol she followed for 120 days, 4 months actually. She came back. They are so excited and so happy and so pleased with their decision to come here to my clinic because the tremors in the neck are almost 100% gone in just 4 months from this work alone. No other therapies or drugs or surgeries were performed on her. She has no more incontinence in her bladder, no more shortness of breath. Fatigue is down. Her depression is gone. She's so happy now. The cold feet are gone. Her energy is up. She's dancing. She's enjoying life. And it's sustained improvement at this point. This is not like she took a medicine, felt better, got off the medicine, or the medicine wore off and the symptoms came back. This is lasting improvement because we're getting rid of the causes, the root causes of her disease. No other doctor looked for those. That's what I do. It's not treating her Parkinson's type of tremor. It's not treating the incontinence. It's not treating the cold feet. It's not treating the shortness of breath. It's finding the root causes of the condition in her as an individual, providing the body safe and effective formulas that help get the different toxins and infections out of those specific tissues where I found them. And once those infections and toxins have been gone, she is feeling relief, and you can too. Her next protocol, I may not share that with you right now. There is more that I found in her follow-up exam, and I expect her to come back and even be more improved after her now second protocol when I saw her April of 2022. When she comes back with her husband, when she comes back again after this protocol, I can share with you the results from that as well. I look forward to helping you. We can get the job done together. You can experience relief from your condition. There is no need to suffer anymore when you can actually find the causes and rid them. You've got to understand when chemicals and infections get into the tissues, they rob the brain's ability of, let's say it is a dopamine deficiency, it robs the brain's ability of producing the dopamine. If you have a fire, you turn off the gasoline to the fire so you can put out the fire. You don't leave the gas on and try to put out the fire. You got to remove the causes of that inflammation, the causes of the deficiencies of the system, the causes of the malfunction. And that's what this is all about. Download your free copy of my ebook. I mentioned that earlier. Download your free copy of my ebook, read through that, take less than an hour, watch the videos that are linked in my ebook, check out other videos that are on my YouTube channel, on my Facebook page, and throughout my website. You'll see there's other patients, other people who have gotten better with my work, with many other conditions. I look forward to helping you. You can call my clinic at 954-370-3100. That's 954-370-3100. Or you can send an email to my clinic. Send an email. My assistant, she'll be very happy to help you. She's a very sweet woman, very happy to help you to set up your appointments with me. I'll tell you one more thing. Insurance companies don't recognize my work. There's nothing I can do about that. My job is to find out strategies to help you get better. My job is to help you get better and be a physician, not a negotiator with insurance companies. Insurance companies don't recognize this. That is not what they're offering you. There's nothing I can do about that. But what I can do is offer you services that can help you find and rid the causes safely and effectively, rid the causes of your individual disease. Whether that takes a month or that takes a year of complete resolve. It's just you're the individual. Your condition is a unique puzzle that we have to figure out. Imagine you'd like to put puzzles together, and there's a puzzle that you want to put together with the Statue of Liberty. You walk by a store, you saw they have Statue of Liberty puzzles, you go in, you notice there are two boxes. They're identical pictures on the box cover of the Statue of Liberty. They're made by different companies. One box has 10 pieces, one box has 1,000 pieces. Both of them, when they're complete, they're going to be a 3-foot by 5-foot picture of the Statue of Liberty. You like them both, you buy them both. You get home, you unbox the 10-piece puzzle. Takes you about 2 hours to put together. Simple. You unbox the 1,000-piece puzzle, and it takes you, maybe it's going to be months of putting those 1,000 pieces together. Maybe you decide the strategy of going with the top right corner first, or top left corner, bottom left corner, bottom right corner. Maybe you go with the feet. Maybe you go with the torch first. Maybe you go with the crown of the Statue of Liberty first. Maybe you go with the big book that she's holding. Maybe you start with your own strategy and you build it out from there. Understand your body has a unique puzzle. Your disease has its own unique puzzle that we've got to be able to figure out, to crack the code to give you the relief from your condition. And you have a high chance, a high possibility and probability that you will find relief from your condition when we can provide the same service like we did for Ms. Cohen, who you've seen in this video. Just realize that your puzzle to liberate you from your condition, from your disease, your puzzle may be only 10 pieces, your puzzle may be a few hundred pieces. Even if you put 200 pieces of the 1,000-piece puzzle together, you still don't see the whole picture. You're not going to put that up on the wall as a completed puzzle. Your disease is what I'm getting at. Your condition, the causes, the pieces of the puzzle, we've got to find them to put you back together, sort of like Humpty Dumpty, if you remember that story as a child. This work is very unique. Read through my book, read through my website. There's a lot there that I can present to you, that I do present to you, that you may have never heard of before. Look at this testimonial again. You'll be very happy. You can achieve what she had. You can have hope. You can start to feel like maybe there's a chance you can overcome your Parkinson's or Parkinson's-like condition. Maybe there's a chance for you that you can overcome your incontinence. I have other incontinence success stories where nothing else worked for them, where it worked from my work. Look for those on my website. Look for those stories on my YouTube channel. Healing can happen. I look forward to helping you. We'll see you soon. Hello, I am Dr. Lonnie Herman, and I'm here with a wonderful patient, a couple who comes to my clinic from Iowa. She came to me actually from Iowa because of some terrible pain symptoms and tremors, multiple different, even breathing problems. So we're just gonna hear her for a few minutes, and I'm glad that you're here to share this and that you're so happy. You're more than welcome, my pleasure. And that we can hear about her improvements so far after her first protocol, and it's really nothing short of amazing. You came here, your husband found me online, right?
Yes.
And it all just made sense when I was reporting. Good. Okay, and so one of your symptoms, which, by the way, what we're going to do is show another video here, a segment of a video where I filmed her sitting right in front of me here in my clinic, and you know what it looks like. I mean,
oh, it was horrible.
The amount of pain she was in.
It was horrible. Pain was awful.
Pain was awful. So one of your symptoms was you had a very poor range of motion in your neck.
Yes.
You couldn't even turn your head really right and left.
No.
And now go ahead, without turning your body, see if you can turn and look at your husband right now. The range of motion
look at my husband and
tremendous. Tremendous. Your head was constantly shaking.
Yes.
Constantly shaking.
Yes.
So the range of motion has improved. Tremendous.
Oh, tremendous.
The shaking of your head, it's still there.
It's
First
still
round,
there.
only one protocol that we've done, but you've reduced the severity of the shaking.
Yes.
And you've reduced the amount of the frequency of the tremors in your head.
Yes, sir.
Yes, okay. You also had intense neck pain. In the video, you're going to see her sitting there with this look of just anguish of pain on her face, and she's rubbing her neck because the pain was so bad. Your neck pain, I mean, I haven't even seen you touch your neck
No.
or even describe pain at all today.
Haven't even touched it today.
Not at
That's
all.
wonderful.
Yeah. So the pain is for the neck is what, about almost 100%?
I'd give it 90%.
90%.
Yeah,
gone.
I'd give it a 90%.
Okay. One of your other problems was, as your husband described, she had these big muscle knots in the back of the neck, like humps or bumps on the
Yes.
back of the spine.
We call it like you see the older ladies, they get it in their neck where they start bending down. She had a huge bump there, and then between the shoulder blades, because I gave her massages to help her out, she also had muscle bumps, I guess, or where the muscles are all tensed up. And those have went away 95%. I mean, if I put my arms over when I give a massage, I can feel that there's some tension around there, but they basically have gone, and that is just amazing.
Phenomenal.
It really is.
When you touch the muscles on the back, that's about 95% gone. You don't feel those bumps anymore.
Yeah, because before, when she would lay down on her back, you could literally just, if you looked across it, like a piece of it, I mean, you could literally just see these bumps and of the muscles all, the tension in them. And like I said, they're like 95% gone.
Phenomenal.
I mean, I have to look for them now.
And prior to coming here for that first protocol, prior to that first visit, which was November 29th of 2021, right now we're April 15th of 2022, just 5 months later, almost, you were going to chiropractors.
Yep.
You had massage.
Yep.
And nothing ever took that away.
No, nothing
before
ever
this.
took it away.
Yep.
No.
You also had cold feet. That was a constant problem?
Yeah.
Even in the warm weather?
Yes.
Do you have cold feet anymore?
No,
Totally
I do
gone.
not. It's totally gone. It's
Even
totally
in the
gone.
cold weather, you feel
Even in the cold weather. It's great.
Phenomenal.
Yes.
One of your other problems that you have relief from was you had a breathing problem.
Yes.
Can you describe what that was like for you?
Oh, I
back
smoked
then?
for years, smoked cigarettes for years, and I would go up and down my flights of stairs, which I have two in my house, and I would be heavy breathing. And
Just doing one flight.
Just one flight.
When you went to go up the stairs, what would happen to you when you were
I was heavy breathing. I
heavy
couldn't
breathing?
do it.
Did
She
you have to,
literally
like,
sometimes
I
have to stop.
have to
and
stop.
take a breath. Take a deep breath and okay,
Labor,
got
yeah.
this. Yeah.
and then wait a few
And then
seconds
wait a
or a
few
minute or
seconds
so,
and-
and then
yep.
you could start
And
walking
then-
up the stairs
yep.
again. And then you get up the stairs, and,
And
then you
then
gotta
do it again.
stop again.
Yep, do it
And-
all over
and
again.
Even when you were coming down that flight of stairs, did it happen again, or was it only going upstairs?
It was only going up.
Okay. Did you have any other breathing problem at any other time, or was it only up the stairs?
It was usually up the stairs, but dancing too. I love to dance, and I couldn't dance very much anymore. And now I dance all the time again. It's wonderful. Fourth day of my protocol, I ended up not having to breathe heavy, going upstairs. I have stairs at work I have to go up, and I don't have to take a deep breath when I get up and go.
It's not just a step of flares.
No.
We have now she can go from the basement to the second floor of the house
Yes, it's
without
wonderful.
having issues.
Without having any breathing
Yeah.
issue?
Yeah.
How many years did you have the breathing issue?
Oh,
It's
lot
been
of
really-
years.
It's been really bad the last couple of
Yes.
years. I mean, she would literally going up one floor. She would stop halfway if I'd be behind her and I have to wait for her to catch her breath.
Wow.
So I mean, it was a huge increase, and that right there was the proof we needed that
That was
it's
it.
it's
Yeah, it
working.
was
This is
it.
working.
Yeah, this is working.
Not too
Yeah.
good to be true.
Yeah.
So by the fourth day, you woke up and you said,
Yeah.
What did you do? Like, how
Yeah.
shocking was that for you?
It was wonderful. It was wonderful to be able to breathe and not have the issues of my lungs going, okay, I can't breathe. And now I can dance around again. It's great. I love that.
Awesome. I'm happy for you.
Thank you.
She's smiling. This is not a painful face. You had hip pain on the left side and the right side.
Yes.
The left side hip pain, is it there anymore?
No, it's totally gone.
The right side hip pain,
It's still there.
but it's reduced.
It's
in
reduced.
what severity? How much severity level and frequency level has it
Well,
decreased?
I used to call into work like 3 times a week, and now maybe once every 2 weeks. So I've done pretty good in my books.
And the severity of the hip pain, you'd say
It's done.
50%?
Yeah, I'd say 50%.
50%
Yes.
severity and frequency
Yes.
reduction, and you can work.
Yes.
And you used to not be able to work. You took off multiple days off
Yes,
because
multiple
of the breathing
days.
in the back.
Many
and now-
days,
And now
yes.
you're working all the time now.
Yes.
And they're
Yeah.
surprised to see you.
Yes.
They're happy.
They are happy
We
to
went
see
through
me.
all the doctors.
You
I
went-
mean, we literally went all the way through the University of Iowa, which is as far as our insurance would let us go. And then I happened to run into you online while I was investigating, and he said, as soon as I read your stuff, I'm like, we're going down. We're doing it.
And even with the doctors that you went to, what was it? Neurologist, orthopedist, was
Neurologist.
a physical therapist? Was there what kind of rheumatologist? What'd you do?
2 neurologists, 1 rheumatologist, and a pain doctor, and also my regular doctor.
And nothing ever worked. They
Nothing.
never saw anything wrong. They
No.
couldn't figure it out.
Nope.
No.
We did.
Yes, we
And
did,
still
and we
are.
are.
One of your other symptoms, and this is one of even more greater of the relief that you've experienced so far, was you had a really bad, overactive, uncontrollable bladder, urine
Oh,
bladder.
yes.
Can you describe what it was like then and what it is now?
Well, I had to go through pads, several pads a day, and it was very embarrassing to have. And I have no issues. I have not wore pads for a couple months. Yeah, a couple months. It's wonderful.
And those pads, it wasn't diapers, but it was a thick pad. Thick
Yes,
pads
it was
then,
those
because
depend pads or whatever.
Depends pads.
Yeah.
So you wore those pads because you'd leak pretty
Oh,
often.
yes,
And
leak.
you had,
and-
how many times a day did you change them?
Oh, 4 or 5 times a day.
4 times a day. Did you ever, excuse me, since you're being so open and I'm grateful you're sharing this with people, did you wet your bed at night ever?
Oh, yes. Oh, yes.
And you wore the pads to bed at night.
Oh,
so
yes.
you wouldn't-
Yes.
And you literally, it wasn't just like bending over to pick something up or walking upstairs where you lost control. It could happen at any time.
It happened at any
Anytime,
time.
anywhere.
Yep.
Anywhere.
Yep.
And so now it's been a couple of months. You have no more pads.
No more pads.
No more leaky bladder.
No.
100% complete bladder control.
Beautiful.
I don't think I've ordered her pads for 4 months, probably.
Yeah.
I mean, it was shortly afterwards.
How many years did you have to wear those pads?
Oh, I'd say a couple of years.
Couple of
Say
years.
a year and a
Yeah.
half, 2 years.
And now it's saving you
I'd say
$100
$100
a month.
$500.
$100. a month.
$100. Oh, I'm
Yeah.
sorry, dear.
the bladder problem is gone.
Yes.
The cold feet, gone.
Yes.
The breathing problem you had for years is gone.
Yes.
You can dance. You can walk upstairs without stopping.
Yes.
Your back pain, your hip pain, great reduction. Not completely gone, but you're able to work. It's not holding you back. You can start to live again because you can dance.
Right.
You're laughing. You're not crying. Your eyes are not in that pain. Your neck is not in that pain. You have good range of motion. And the head shaking, one of the main reasons, not the only reason, but one of the main reasons was the constant head tremor.
Yes.
And it has decreased in its severity.
It has. It's
So we're
wonderful.
pretty happy. And the neck pain is nowhere near what it was.
No, nowhere near.
Yeah, awesome.
Yeah, it's just me watching that video again. I mean, that really brought back memories. That to
It
me
did.
is what showed how far she's come.
It was
you know.
crazy.
I mean,
How bad that was.
amazing.
Yeah, that's great. I like to take before videos, before we start protocols, before we start caring for people. So when they can come back in a few months after treatment, look at that past,
Yeah.
you know, what you were like and revisit. So I'm really happy that you have been so generous with sharing this with people. And I know you're telling everybody around you.
Oh,
where
yes.
you live. Is there anything that you can tell somebody now, because you talk to people around you who live and work near you, is there anything that you can tell them of, you know, it's just not too good to be true, or who think it's too good to be true, or just maybe they should give it a try? Is there anything else besides what you've already been so generous this year? Is there anything else that you want to tell people?
Well, I would just say, I mean, if you've went through and you've dealt with pain of any sort and you're getting nowhere with the doctors, because the doctors are just there to cover up your symptoms in the first place. And you sit there and you're thinking that this stuff just sounds too weird to be true. It's
true.
not.
It's
It
great.
really isn't. I mean, yes, you're going to have to take a little leap of faith. The insurance doesn't want to pay for it, but like I said, they don't want to pay for anything that's going to cure you. They only want to keep giving you more and more drugs to keep you coming back. So if you're even thinking about it, if you've got the pain, this is well worth the time. I mean, like I said, we found out in the first
Yes.
week. I mean, we've ever since the first week, we've seen the improvements. The other stuff that we're doing, you know, we're moving some mold and stuff. We may not know what it's doing, but I have no repercussions or qualms of that it's not doing anything because I
doubt.
seen what it
Yes,
did
no
right off the
doubts.
bat.
Yeah, right off the bat.
Yep.
Pretty
So
awesome.
I would say go for it. I mean, you're not going to regret it.
Thank you.
Never going to regret it.
Thank you. Thank you. Thank you. Some people, it takes a little more time. Sometimes it's as fast. Sometimes it'll take a few more weeks or another treatment. But the relief from your disease can come your way. You too can get better. I look forward to helping you get better too.